Dr. Anbumani Ramadoss, Member of Parliament, former Union Health Minister and Chief Ministerial candidate of the PMK for Tamil Nadu. He is the one who fought against tobacco lobby and brought daring reforms. He banned smoking in public places and introduced the 108 ambulance emergency service in India. He has worked for polio eradication. He is a crusader against alcohol and alcoholism in Tamil Nadu. He is the one who has conducted maximum protests for closing alcohol shops involving women. I now request Dr. Anbumani Ramadoss to render his speech on the topic health. Please, sir.
Dignitaries, friends, I wish you all a very good evening, and warm evening it is. A Chennai warm evening. I would like to thank the organizers, especially the Institute of Humanities and Social Science, IIT Madras, as well as the Prime Point Foundation, Mr. Srinivasan, and the E-Magazine for inviting me to this wonderful national seminar. Since we have a time restriction, where's my friend? I'll try to make it short. I've been called to give you inputs about the health status of India today. India is a complex country, we all know. India has countries within the country. If Uttar Pradesh was a country by population, it would have been the 4th largest country in the world. Uttar Pradesh and Brazil has the same population. Bihar and Uttar Pradesh put together is the population of the United States. The population of Maharashtra is equal to the population of the United Kingdom. United Andhra Pradesh is equal to Germany. Tamil Nadu is equal to France. Karnataka is equal to Spain. So we have countries within our country. It's quite complex. We have about 18 official languages. We have 250 dialects, more than 3,000 sub-dialects. You have a different community, religion, creed, caste, race. So it's a very, very complex part of the world. And to take in health, percolate health to the furthest section in India needs a lot of perseverance, hard work, and investment. So today the need is investment, and investment, public investment, the government investment. I just take you to a different country, Germany. We know Germany is a developed country. Comparing Germany with India. In Germany, the total investment in health is about 11.5% of their GDP. In India, the total investment is about 6% of India's GDP. But the difference in Germany and in India is, in Germany, 88% of investment is in the government sector. And the rest, 12%, the people have health insurance. So none in Germany spend out of their pockets. But in India, out of 6% of the GDP, 0.9% is from the government. And 5.1% is from the individual. Unfortunately, all these years, India, we had 80% of infrastructure in the private sector, or maybe 75%. And about 20 to 25% is in the public sector. So that is the reason where it's the highest reason for rural indebtedness. You can see the parameters. In Germany, the infant mortality rate is 3 per 1,000 live births. The maternal mortality rate is 7 per 100,000 deliveries. Whereas in India, it is 40 per 1,000 live births and 166 per 100,000 deliveries. This parameter, in fact, has come down in the last 10 years. In fact, we have had success stories in India. It's not like India is just one side is just on the downside. Like we definitely have had our success stories. In fact, when I was the minister in 2004 to 2009, health minister, we brought a lot of reforms. The biggest public health program in the entire world was started on April 12, 2005, called the National Rural Health Mission. So down 10 years from the NRHM in India, when NRHM was started, the infant mortality in India was 68 per 1,000 live births. Today it's 40. When NRHM was started, the maternal mortality in India was 301 per 100,000 deliveries. Today it's 166. So, and when NRHM was started, the total fertility rate in India was 2.9, today is 2.2. So in 10 years, India has reduced maternal mortality and infant mortality by about 50%. It's a huge, huge achievement, but it has not been recognized. And not only that, today we have polio free. Imagine India being polio free. And India has eradicated, not eliminated, eradicated polio. We have been free for last 3 years. How? Because of our perseverance. Can you imagine 300 million children being vaccinated in one single day? Not happened anywhere in the world. The entire population of the United States is 300 million. Because we have vaccinated 300 million. So that is the hard work, sheer hard work of our people. India has reduced HIV AIDS by 50%. So we have had a lot of successes in the health sector, but then these are individual successes. What today we need is health assurance. It's also part of health insurance. Health assurance is, it's just not only health, investment in health only. It's investment in our clean water, drinking water, investment in our sanitation, cleanliness and sanitation, investment in our nutrition, and investment in our environment. So all put together is a health assurance. That is what is needed for a country. Bits and pieces here and there doesn't suffice. So that is something where the government of India today needs to look at it. Invest more on health. Like, I want to digress a little bit here. What South Korea did on education. How South Korea and India were on the same lines 50 years ago, because South and North had a civil war, and the South people were begging for a bowl of kanji every day, one kanji a day. But today South Korea is a developed country. We have Hyundai, and then we have all these Samsung, LG, all these things. They're far ahead. Why? How? They invested in education. And not only invested in education, after education they invested in occasional and skill training. South Korea and Tamil Nadu's population are, South Korea is less than Tamil Nadu's population. But today South Korea has occasional training and skill training institutions more than India. Not more than Tamil Nadu, more than India. This is what is needed here in India. Not some empty rhetoric. But unfortunately the government today is not investing much. Where is my Mohan, my friend? Bharat Mat. Government is solunga. This is something where we need to dump money. When you say the highest reason for rural indebtedness is health spending. It's not spending on education. It's not spending on agriculture. It's not spending on housing. It's not spending on clothing. It's not spending on food. It's spending on health. And when the head of the family in a village has some health disorder, what he does? He sells his livelihood, land, and he gets treated. And then what next? Nothing. They are on the road. So this is what is needed. And we have lots of surveys done. We have recent survey, National Economic Social Survey, which says that the highest reason for rural indebtedness is what I reiterate my point, plus urban-rural divide. Yes, we have our infrastructure. We have different models. There are different models in the world which we can follow. We need not reinvent the wheel. We have the Cuban model. I'm not talking about the Cuban cigar. The Cuban model, where you have one doctor and the doctor's work per year is to take care of 5,000 population. It's not the patient or people, it's not the patient, I'm not calling the patient, it's the people. The people going to the doctor, it's a doctor visiting the population and saying, are you all right? He'll check the BP, blood pressure, everything. And that's what we need, preventive care. There's no point dumping money on just treating tertiary. What we need is preventive and a promotive care. We have had our integrated system of medicine. We have had our traditional knowledge, our Ayurveda, our Siddha. Homeopathy has come from Germany. Unani has come from Persia. Yoga founded in India, exported to America, imported back to India. Because we follow the Americans. But yoga, it was validated by the Americans. The Harvards and the Johns Hopkins, they validated it and they found that yoga reduces blood pressure. Yoga reduces diabetes. It reduces mental depression, mental stress. And they scientifically validated, and that's why the world is following yoga. Today yoga needs to be inculcated among the youth. It should be made compulsory in schools. Mohan, kettiktingla. So, good, very good. So, this is something where we need to take in the best practices, worldwide best practice, the National Health System, NHS in UK. It's a fantastic system post-World War. The UK people where they were broke, the government was broke. The Prime Minister, he said that his vision that he wanted all the population, entire population to have public infrastructure, and said he's going to invest a new concept called the National Health Service. People are skeptical. They were angry, they were annoyed, saying that what is this they're trying to do? We don't have food to eat. Then that is the system where today is one of the most successful systems where 92% of the people in UK are treated in government hospitals. 92. And the hospitals, the public hospitals are better than our Apollos. So this is what is needed here. Investment in more in the public infrastructure. And the money. But today in India, when you say 0.9% of India's GDP, GDP is of course growing every year. It's a meager amount. The rest is by the individual. And so our target is 2.5% of the GDP. At least 2.5%. So when I was minister, it was 0.8%. Then during my tenure, it went to 1.2%. Now it's come back to its old self of 0.8%, 0.9%. So we need these things like. Then issues about tobacco and alcohol, which I definitely need to address it. Like today, the biggest killer in India. Can you tell what it is? Cancer? Alcohol. Today the biggest killer in India is alcohol. 18 lakh people die due to alcohol directly and indirectly in India. 18 lakh. 10 lakh people die due to tobacco in India. Only 5 to 7 lakh people die due to communicable diseases. So then where are we barking on the wrong tree? We have to take these. When we say 18 lakh people, it's just not people dying. It's family ruined. Society being ruined. We saw that Kolaveri song. I'm sure all of you remember. Kolaveri went viral. The YouTube and all that. Today the thing going viral in Tamil Nadu, what is it? A 4-year-old child drinking. Can you imagine a 4-year-old kid drinking? And a 3-year-old putting that tobacco and stuff. I mean, where are we going? So our government needs to take proactive steps in that and not shy away from the responsibilities. We see that in Madurai there was a school where the benches have been disappearing. Vadipatti near Madurai. Then the people said, where the bench is going? They found out that the children, they were stealing the benches and drinking, selling it and drinking. Because this is a very, very important issue, which I'm sure you also are with me in that light. Plus, we see in Karur, near Karur, there were 2 boys in uniform, drunk, lying on the platform near the bus stand. They were 9th standard, studying in 9th standard. There was a 9th standard boy pedaling a cycle with a beer bottle tucked inside, happily going, trying to drink beer. It exploded, the beer bottle stuck him in the stomach and he died in the hospital. These are individual instances. One point of time, the age of initiation of alcohol was 40, then it came to 30, 29, 25, 19, today it is 13. And I could go down and say it's 4 years also today, in Tamil Nadu especially. So we need to have these policies. The government needs to, okay, say it's your individual right to drink, yes, fine. But then it's not the government's duty to sell alcohol. The government's responsibility to give you education, to give you health care, to give you employment, to give you agriculture. The agriculture is, farmers should be happy. So nothing is, what is happening? So that way we need to introspect. And then there need to be availability of generic medicines throughout the country because of the costs of medicines, exorbitant costs of medicines. So that the government has to provide. Then we need to invest money on health research. But are we? Today I could see the IIT director here. But then he has nothing to do with health research. But then some of, I think when I was the minister, we are partnering some health and the technology. In fact, like MIT and Harvard MIT, they were health biomechanical department there was. So we had lots of inventions needed. Innovation is need of the hour. But most of what we do in India is plagiarism. You know, that's why we are famous for our copycat stickers. Like. So that is something where we need to invest money because we need to have an Indian-oriented, country-oriented treatment regime, not the West-oriented regime. We follow the American system of treating. Their body is different and our body is different. Their genes are different and ours are different. So these are the things somewhere the government needs to rethink, relocate. Also we need our tertiary care, secondary care. We need big hospitals. We're doing good into medical tourism. One point of time, our people are going to America for treatment. Today, Americans are coming to India for treatment. That is our flip side. That's okay. But then what about our laborers, our rural masses? What about their lives? Like we have to look at their lives holistically. We need doctors going to rural areas. When during my tenure as minister, I made it compulsory that all doctors should go to rural area at least for 1 year. But then unfortunately it was scuttled. It went to litigation, the famous judiciary. So these are some things like we need to introspect. And then of course we need manpower. Manpower is lacking in India. India has a population of 1.25 billion. It's growing every year. But do we have the requisite manpower for it? Do we have the doctors for it? Nurses for it? No. India has 9.3 lakh doctors. India needs 20 lakh doctors. India has 17 lakh nurses. India needs 30 lakh nurses. The WHO equation of doctor population ratio is 700 population per one doctor. But then we have 2000 population for one doctor. We can combine our traditional system, Indian system, and then be little close to about 1200 population per doctor. But then we have about 381 medical colleges. We need about 600 medical colleges. And most of them in the public sector. The government needs to invest here. Tamil Nadu, one example where 32 districts, all 32 districts should have medical colleges. And they have to be the tertiary care. They have to be the focus on that. That infrastructure needs to be invested by the government. The budget for the government, Mohan, last year was 38,000 crores. This year was 32,000 crores. There is a less reduction in 6,000 crores by the government of India on the health sector. Please note this. And the reason you say that, you're giving the states the GST, the benefit, and you're giving states more money. But then will the state invest this on health? No. States are investing in freebies, unnecessary freebies. States are investing this in alcohol. States are investing in what schemes they want, not on health. Do you guarantee that states will invest in health and education? No. So that is what the government has to take. It's a government responsibility of the government. It's not only the state, the central government. So these things is what the need of the hour. And I think I can go on and on, but then my colleague here is looking at me. And yes, so I could summarize and say that yes, we need investment in the public sector more. We need, and the primary sector should be the focus. We have a good program called National Rural Health Mission, which I told the success story of the National Rural Health Mission, where the MMR, the TFR, the IMR, it's been reduced in 10 years. It has not been achieved in the last 56 years in India. In 10 years, so it has been success. Because when I was minister, I used to dream this program, I used to eat it, I used to breathe this program, NRHM, every morning, every evening, every night before going to sleep. So that is how this success, because earlier the primary health center, to buy a pin, safety pin in the primary health center, the doctor there has to write an Indian saying that we need a syringe. So that's it goes to the district, it goes to the state headquarters, it takes 3 months. Okay, fine. Today, it takes just 1 minute for him. He can buy it. Because we have dumped funds in the PHCs. We have through this program. The money from Delhi comes directly, not goes to the Chennai. It goes directly to the districts, district health society, the public health society, the public health center society. So that is integrated. We need public-private participations as well, like the 108 ambulance model. Today it is running successfully in nearly about 21 states. And saving crores, hundreds of thousands of lives. And when we first took a review of that 108, earlier ambulances were just a transport vehicle in India. We had our ambulances. It used to go to an accident, it goes after an hour, by the time he is dead. Otherwise it goes there, it dumps him in an ambulance and dumps him in the hospital. There's no ambulatory in that. It was only a transport vehicle. But then I saw America 911. Some good models we have to pick up from America as well. Like. So 911. So I said, why can't 911 be here? Come here. 1 year it took me. I got guys from Stanford. They gave me inputs about a lot of things like. We had the 6 Sigma models. And then we trained the paramedics. And today, why these ambulances are successful today is 80% of treatment is done in the ambulance. That is what is successful. That was what is successful there in the US. So that is what is successful here today. So those best practices, and that is a public-private partnership. The 108 is a public-private, the investment is in government, the running is in the private. So it is a successful model. And when my first review I took, I saw that the highest phone calls for 108 ambulances in India was not for accidents, it was a maternity. 24% of the calls were for maternity. I was so happy. I was so happy. And only 21% was for accidents. And today it is still the same. Earlier in a village, they have a labor pain, night, early morning, 2 o'clock, they could do nothing. They have to take a bullock cart or they wait for the bus in the morning. Today one small toll-free number, 108, 10 minutes it comes and saves. Today we have 16,000 babies delivered in 108 ambulance. So these are some of the things where as India, yes, we have been successful, but it is not enough. We have a long way to go. The government's participation, half minute. The government's participation, the public's participation, the individual participation, and so that is the need of the hour, and the government has to invest. Thank you.
That indeed was a power-packed speech by Dr. Anbumani Ramadoss. I didn't have the heart to stop them, but I had to do it. I request Surya SG to give a memento to Dr. Anbumani Ramadoss. Thank you, sir.